Hello and welcome to Things I've Learned. Today we have Ron, my co-host, myself, Allie, and we have our guest here. You want to introduce yourself?
Yeah, I'm Bethsa Becerra.
Perfect. And just give us a little overview. Where are you from? Where did you grow up? What is your ethnicity?
So I was born in Peru, and I came to the States when I was 7 years old. My parents immigrated to the U.S. when I was 2 years old, and then I was finally able to get a visa, and I came when I was 7. Went to school at BYU, Idaho, and I got a bachelor's degree in public health with an emphasis in epidemiology. I then moved to Utah because I saw a lot of opportunities for growth, and it's just a great place to start and affordable. I was hired at the health department as a community health educator, and I've been here ever since. I think I've been here for about almost 2 years now, so it's been a great experience. I love Utah, and I love to hike.
There's lots of hiking in Utah, so.
I love the mountains. That's what keeps me here.
Mm-hmm. Yeah, that's what I was there for like 10 years, so.
Oh, wow.
Yeah, that kept me there for a while, and now I'm back in Georgia, so.
Oh, that's awesome. Betsy, can you repeat again what you said? Where are you currently working at right now? Like, what is your position?
Yeah, so I currently work at the Weber Morgan Health Department, and I'm a community health educator. That's my title. And so when people see that, we wear a lot of hats, community health educators. So I specifically work in the health promotion division. And what I do, what I'm doing right now is I'm the enforcement lead in the tobacco prevention program. And so what we do is we work with officers, we work with lawyers, and we try to create policies for the tobacco regulations and the laws that they have in Utah. And what I do is we do compliance checks. And what those are is I hire teams and I set it up with officers, and we check all the tobacco stores, so all the stores that sell tobacco, and the teens that are underage go and buy tobacco products. So they're protected under the law because we're with an officer. And basically we check that all stores are compliant with the law. And if they do anything, then we have the right to take away their permit or give them a violation.
Oh, that's
Wow.
cool.
Yeah.
I never knew you guys do that.
Yeah. So the health department is in charge of the tobacco permitting as well.
Right. So how'd you end up finding such a sweet job? I mean, sounds really interesting. I like it. Very cool.
It's kind of funny. So I did an internship in health promotion in Provo, Utah, in a place called Centro Hispano. It's basically a center that helps people. It's a nonprofit organization that helps the Hispanic and low-income population in the area. And so I wanted to focus on epidemiology. I couldn't find any internships, so I did health promotion. And I was in charge. I got to be a little bit in the tobacco team. They were doing like Facebook posts. You know, I'm an intern at that point, so I don't really know too much about it. But I would go to meetings and I did extra trainings. And that's where I met my future boss, who is my current boss right now. And it just so happened that I ran into him during an interview. He said he was hiring, and I interviewed, and I went through several interviews and got the job. So it was really neat.
That's awesome. And what did you say you studied for your undergrad?
Public health with an emphasis in epidemiology.
That's very hot topic right now, epidemiology.
Oh, yeah.
Is it competitive too to get a job? I don't know anything about this field, so.
So it can be. I mean, you have to take extra steps. I had to pay a test that was about $300 to $400 to be certified health education specialist after I graduated. And so I paid for that, and that looks good, especially when you want to work at a health department. And it also helps with pay. It just shows that you took an extra step other than your undergrad and your bachelor's degree. I think it also helps that you, like, if you go to trainings and meet more people, I think it can be competitive. You just have to know the right people.
So how did you come to decide that specific field?
The specific field that I'm in.
Mm-hmm.
So kind of
a
funny.
hard question.
No, I know. I'm trying to think about
it's a big question. Yeah.
So I first wanted to do nursing. Actually, I was in the nursing program in Idaho.
Mm-hmm.
And I grew up, that's what my family told me, like, oh, you should be a nurse. I never questioned it. So I got into the nursing program and everything, and I was in the program for a semester or two. And then after that, I realized that I just wasn't thinking like a nurse. Like my critical thinking wasn't a nurse's critical thinking. And it was really frustrating for me. And so I couldn't pass the tests. They were, you had to get an 80 or above for the test. I would always get a 79.
Oh, it's,
Oh my gosh.
Yeah, and so I had all A's in all my classes, but in order to move on to the next semester, you had to have an 80 on one test only. And that one test gave me anxiety. And so, yeah, so I couldn't do it anymore. I was really disappointed. I went through like a very dark time in my life. There was a lot of things that were going on around that time as well. And so I decided to change and see what was similar to all the classes that I have taken. And I chose public health because it's so broad and there's so many things that you can do. Even to this day, like I meet with people and there's still new things that I'm like, wow, I didn't know you could do this in public health. So that's how I ended up in the public health field.
was this during so you get to nursing program, still a bachelor degree, right?
Yeah, I was
And so when you decide to make the jump, the major change, right? You change majors, I'm assuming. And that's where you got the internship, right? As well?
Yeah, that a few semesters after I got the internship.
Okay. I'm trying to create a timeline right here in my mind right now.
Yeah, so I guess I wanted to ask a little bit more about public health in general, for people who I don't totally know a ton about public health. I know like some, because I have some friends in that arena, but so when you study public health, what other career choices can you go into?
A lot of people can go into, well, first of all, public health can be very broad. We see public health everywhere. We just don't notice it. For example, we create policies of the age of tobacco, right? And so we just increased it in Utah or everywhere, right, to 21. We see it in the Utah Clean Air Acts that like people can't smoke 25 feet from the entrance. So we see that a lot, or like cigarette smoking was a big thing back then. A lot of people are against public health, especially right now. The face mask is it's a political thing. And so actually that's more from the CDC, but we have to support and follow whatever the CDC requires. So there's a lot that lands on public health. Public health is a huge hot topic right now because of coronavirus. And I actually had to get my feet wet and do a lot of COVID-19 investigations. Public health, when there's an emergency, we switch hats and we have to do whatever is necessary. I mean, there's always an opportunity. I know that if a natural disaster, a virus, a pandemic happens, like I'll always have a job and there's always going to be a job for us to do to help the community. And that's why I love, you can do epidemiology, you can be a teacher and teach. I used to teach sex ed, for example. That was a wonderful experience. It was awesome. And very uncomfortable at some points. You can teach drug addicts. I taught safe dates to drug addicts. There's just so much you can do. It's never ending, I feel.
I didn't know that about public health, that you would have to switch hats if there was like a big, like right now, a pandemic. That's a lot. I feel like a lot to put on your shoulders. Get like quick training.
Yeah. So what happened when the pandemic started? Nurses, or we're required to do COVID-19 tracing. We do that with HIV. So basically we interview each person, we ask them like verify all the demographics, and that helps with data, right, in the future. And we can use that for research. And then we will ask them who they've been in contact with, and we just have to follow up and see every person that they've been in contact with, then call those people, tell them that they have to quarantine, give them the bad news. And so that was a lot for me, because a lot of my job stopped because we work in the community, so we couldn't see the community anymore. So they were like, okay, this is what we're doing. And I was one of the first ones in the county to start it because I'm a Spanish speaking employee there. I was actually the only one at some point, and it was really stressful.
Do you think and I don't know anything about Utah as well. Like I never lived there. I never visited there. You think you get fairly compensated for what you do?
I think in our field, and especially the agency that I work for, well, I do work for like the county, but yes, I think we do. I have great supervisors and leaders who give us incentives like to be healthy and compensate us for doing a great job every 6 months.
Mm.
And so they really do give me an opportunity to give me more experience so that I can move on in the future and go somewhere else. Like I feel very very grateful in the field that I am, and especially under the leaders that I'm under, because I know not every job is like that. And so I feel lucky, honestly. I don't know if it's like that everywhere.
Well, is there like a pay gap then? Like, or like is like a pay like like if you've served 10 years under this corporate job, right, or agency job, is there like a cap limit where you max out, or you have to get
Yeah,
a bachelor's degree, or you know keep up leveling up?
yeah. They give us opportunities to level up all the time. So I haven't seen any cap on it. Especially, I was actually talking to my supervisor the other day, and he was just talking to me about, when he was a supervisor, like they didn't incentivize anything, and they didn't increase his wage because he had a master's degree. And so a lot of things had changed over the time, that now if you have a master's degree, they will pay you more. If you take more responsibility, they want to pay you more,
Mm.
because they want employees to feel needed and that they're accomplishing something. If not, it's not really worth working there.
Yeah.
Unfortunately, right? We all need
Yeah,
to
we
pay
all
the
need money.
bills and
Do you think that's because it's a government agency that they're wanting to like incentivize their employees?
yes and no. I think the leaders that
Hmm.
we work under grants. So, for example, we do a lot of grant writing, and we'll get grant from the CDC. We'll get $100,000, and
Hmm.
so like our supervisors kind of set up the budgets. So they started increasing the budgets and giving us more, incentivizing us with more funds so that we can do our jobs. So it's up to them really how to manage the money that's coming in, which is great. I love
Wow, I think I learned a lot.
it.
So, as far as I guess like future goals for your career, because you said you kind of had fallen into more of like the community aspect of it, where do you see yourself going?
So I have a goal. My goal is to start up a clinic for low income and Hispanic community, mostly low income, because I do see that there is a huge gap with the services that are provided in here. For example, in Ogden, we have a huge Hispanic population.
Hmm.
And so I mean, I even saw the gap when the pandemic started, that there were no materials in Spanish. Hispanic people didn't even know what COVID-19 was. They didn't know where to get tested. What if people didn't have insurance? I definitely want to be a leader. And basically, right now I'm doing the groundwork, but I'm going to school so that I can be a leader to help kind of that go down, filter down, so that I can lead future employees so that they can be better for the community. And I do want to work more in a clinical setting. I mean, I love nursing, but I don't think I can do the work. It's a lot of work, and it's very rewarding. But I know that if I can lead and manage and kind of set the culture, like the environment that I'm in, then I'm able to help the community. So that's my future goal.
That's an
Wow.
awesome goal. That you're right. That's like super needed with a lot of health initiatives and a lot of even
Yeah.
like government initiatives. The Spanish population, I feel like it's a really big population, and then
Mm-hmm.
we don't always get all
With
the resources that we need. So that's awesome.
Right. Yeah. And the resources that I didn't know. I mean, there's so many resources out there that, I mean, I know because I work, but
Mhm.
back then I wish my parents would have known about these resources. So,
For sure.
Do you think because the way how you grew up, with immigrant parents and how being like always thought of an afterthought, the reason why you're so motivated to helping, especially low income communities?
oh, definitely. I mean, that's the reason why I'm doing what I'm doing, because of my life experiences. I grew up more in the low income, right? My parents they were not rich. So I grew up knowing that they didn't have a lot of opportunity, especially as immigrants, right? I'm a DACA recipient. And so even growing up and understanding what I could and could not do in this country really affected me. And so I had to make a lot of sacrifices to get to where I am today. I don't know if you guys know, but DACA students have to pay double tuition, for example, in some states. Luckily in Utah, though, you don't have to. And so before I even applied to get a master's here in Utah, I double checked and they said, if you're a DACA student, you'll still pay in state, which is great. So I think like I took that sacrifice to leave, and being comfortable with my family, moving somewhere else was crucial for me to grow.
Mm-hmm.
So I want to talk more about your life, your childhood. Since you did mention you were a DACA recipient and all that stuff. Like, so when you were graduating high school, why did you decide to go BYU?
So when I graduated high school, honestly, I didn't want to leave. It was funny because a leader from my church, or my bishop, encouraged me to apply, and I didn't want to do it. I was comfortable. I had a boyfriend back then. You know how it is. You're in high school, you just don't want to leave. And so I didn't want to go. And so I remember that leader encouraging me, like, you need to apply. And so I remember he sat me down and we applied together. And I always knew in the back of my head, I was going to go. I guess I needed that little push. Mm-hmm. And, I acted like I wasn't excited about it. I only applied to one school because I knew, like, I'm going to Idaho. Even though I knew there was Provo and Hawaii, mm-hmm. I was just like, okay, this is affordable. This makes sense. I'm going there. I don't know anything about Idaho. So I applied, and I remember getting the letter, like, saying that I was accepted. And I was so excited. I was so happy to get out. I felt kind of like I needed to get away. And so that's how I got here. It's just, I guess, through encouragement.
That's awesome. Had you, before that, had you planned to go to college? Are you a first generation?
I am. Yeah, I am. I was always planning on it. I knew I was going to go. Mm-hmm. But I also knew that in order for me, because Georgia, I had to pay out of pocket twice tuition for an in-state. I just knew that I had to get out of there, and BYU was my only option because it's a private school, so you pay a set price. And so that's the reason I left. I had to go somewhere else so that I can get an affordable education.
Yeah, no, that makes sense. Did you have people that you knew that had already applied there? Like, did you know people going in, or?
No, I think we were all applying at the same time. I had some group of friends that were applying around that time.
So it made it a little less scary to go.
I mean, I had one friend. Yeah, it made it a little scary. I had one friend that decided to come, and so it was great.
Okay.
Speaking on that, is there a Latino community in BYU, Idaho?
Yes. It's not that big, but yeah, there's a bigger, I would say they have a big Hispanic population. I mean, it changes, right? Like incoming classes. When I went, I think it had a pretty okay, still not as diverse as I would like it to be, but it's still.
Did you ever feel uncomfortable at one point in your, college experience?
Uncomfortable as like being a Hispanic student?
Like, okay, so like I remember me going to college, right? And when I went to a second year community college, right? Mm-hmm. And there's a lot of minorities there. But once I switched over to a 4-year school, predominantly my classes, especially the higher levels classes, I was the only minority. Mm-hmm. Like, so and I kind of felt uncomfortable because, everybody seemed like they knew each other as well. Now with that within their own classes, because they were, because I was a commuter, right? And they were kind of living there in the campus.
Okay.
And so like I felt like I didn't belong there. When I tried to talk to them, it's just we live two different worlds kind of.
Okay. Yeah, when I went to school, I mean, I would say though it's different from your experience. You start and everyone's a freshman, and so like you meet all the people that are starting with you. And so I actually thought it was a better opportunity for me because I met a lot of friends. I didn't have trouble at all fitting in. Yes, when I did start my nursing classes or the higher level classes, I was the only Hispanic student. But I've never really felt uncomfortable because I'm pretty social. So when I'm I'm just really quick at making friends and making connections. And so I've never really felt that way.
No, that's good though.
Yeah. So,
Well, that's awesome that you had a good experience in college.
does your family know what you do?
Yes.
Like, do they understand what you do though? Or are they just like, oh, you're in healthcare? Because I remember asking my sister, and she tried explaining to me what you do, and I'm like, I don't get it. Like,
Yeah. Well, my aunt knows. My brother doesn't know what I do. Just my aunt, who I talk to all the time, she really knows what I do because she used to work in the health field, and so
So it's easier for her to get what you're doing.
Yeah.
are you still the only Latino in your workplace though?
Spanish speaking and health promotion, yes, in my division.
That's crazy.
Yeah, I know.
Well, yeah, especially because Ogden, like you said, has a really big Spanish population, so you think they'd have.
I mean, there's like health promotion, there's environmental health, and nursing is what the health department is. I would say there's at least one in each division that speaks Spanish. The WIC section has more Spanish speakers.
Okay. So why do you think there aren't more Latinos that go into your field?
I'm not really sure. I feel maybe they don't know about the opportunities in Ogden. Ogden is it's a riskier area to live in. They have like a low income population in certain parts, which is where we focus. I'm not really sure. I think it's maybe because it's far away from the city. I feel like more Weber State students will come here than Utah State or BYU or UVU or any of those places.
Well, what about just in like public health in general? Why do you think there aren't more Latinos? Like in your classes and stuff, like why do you think that might have been?
I'm not really sure. Yeah.
It might be exactly what you said. People maybe don't know that stuff.
Yeah, I didn't know about public health. I think people take public health for granted. I know a lot of people that are like, oh, I'm doing public health, but I don't know what to do with my job, with my life. And I'm like, oh, there's so many opportunities. Like, what do you mean public health? Like, they just, I guess people don't really understand it. So,
So do you think, because I know like you said, I don't understand public health, right? Do you think it's just education wise, like especially people don't really know what they want after college or what specific job they want to get, right? So I think, especially your job, like I didn't know there's such a job existed where you actually go and.
I didn't know either.
But how were you able to find out though? Like through a internship, right?
Yeah, through the internship, I didn't even know about compliance checks or any of that until I started working at the health department, and then I knew that by law the health department focuses on the tobacco portion and tobacco permitting for the stores. So
if there was like any advice you would give somebody right now, like we're about to finish soon, but like, is there any advice you would give
for
like future, like people listening to this interview right now, like future students or people that are going into college right now or just finishing college or even graduating college, can't find a job?
Yeah, I would say do whatever you can and whatever sacrifice you can do. We're young. We can move around to not be comfortable where you're at. And it's okay if we fail. I failed many times. For example, I left the nursing, I basically failed the nursing program, and, I was able to find my actual passion. And then lastly, ask questions, interview people, whatever job that you're interested in, because you never know what you might like. And to really try and research more internship opportunities.
Great. Well, thank you, Bethsa, for everything. Thank you, Bethsa, for this interview. It was really, I learned a lot. I don't know about you.
I did too. I 100% learned a lot. I didn't know all the different career opportunities that you could do with public health, and I think it'll be really beneficial to whoever wants to know more about it.
Yeah, definitely.
Yeah, and if thank you for like doing your part, like especially helping out the community, and just it's amazing. I think I have a amount of respect for you now that not that I didn't have respect for you. But
just now.
Just now. But thank you for doing what you do. I mean, honestly, it's not an easy route. I think sometimes people sometimes, I don't know, they go for the money.
Yeah. Well, thank you guys for giving me the opportunity to interview. I think this will help a lot of people, and that's why I decided to do this, because I know I needed it. So I hope this will help someone else. So what you guys are doing is amazing.
Thank you.
Thank you. It's, you never get a thank you. Like
I know this is our first thank you.
Yeah.
Oh, really? Oh.
Yeah.
Yeah.
Well, Well, guys, if you ever want to just subscribe to our YouTube channel, we have post more interviews about other people and different aspects of life and different career jobs. And if you also want to be in the part of the interview, just hit us up.
You can follow our Instagram at things_I've learned. Shoot us a DM, and don't forget to subscribe, like, comment, and until next time.
Bye.
All right, bye. Thank you guys.